All right. Hello and good morning, everybody. I am here with Dr. Laurie Birkholz, and I'm excited to have you here.
Yeah.
I didn't talk with you about this before, but I'm going to do a $50 gift card for either services or product that you have.
Oh,
If you
fantastic.
like or share this, and then that way
Awesome.
give something back to the viewers that are out there.
Awesome.
So this is part of my Welcome to West Michigan, just to get more information about you and hear your story and kind of learn a little bit about your practice and hear all the good things that you're doing.
Terrific.
All right. So first, what I'd like to do is do a little rapid fire questions.
Okay.
Where did you grow up?
Port Wing, Wisconsin,
Okay.
which is a tiny little town on the south shore of Lake Superior,
Okay.
very far, sort of northwest corner of Wisconsin.
Okay. Are you a Packers fan?
I am, although I've never worn cheese on my hat.
Okay. Well, that's good. Do you prefer cooking or baking?
Oh, baking. It's much more
Baking.
precise. It feels more scientific
Yeah,
to me.
I'm a baker as well. And as the cooker. What's a TV show that you have binged on lately?
Oh, I don't watch a ton of TV, so hold on. Probably the last TV show that we really got into was Game of Thrones.
Game of Thrones, okay.
Although I guess I have to be honest, we did watch Tiger King.
Tiger King, okay. Yeah, that was really big earlier this year.
It was. Thanks to my brother, who was like, you've got to watch this show.
If you had a superpower, what would it be?
Ew. Well, I suppose X-ray vision would be very practical for me from a perspective of my work.
That would be
however,
good.
right? However, shape-shifting would be the coolest.
Nice. What is one thing that you learned the hard way?
Oh, wow. Only
Maybe
one?
in business, yeah. Or
you
any.
know, honestly, actually, life, business, all around, probably for me has been that the only thing constant in life is change. I think probably part of my personality and what drew me to science and medicine is the ability to sort of control and plan. And so for me, the first sort of experience in this space was having kids. Right? Where like you just feel like you're starting to get your rhythm with like their naps and their eating, right? And then like 2 weeks later it changes. That was so difficult. But I feel like it's continued because I had a plan in place for how I was going to start a business. And then COVID happened.
Oh, yeah.
Right? And so I wish I would have developed that more flexible, less rigid approach to life a little bit earlier. But it definitely is something where, again, be it my personal life, my work life, being able to accept that change is not only inevitable, but imperative is probably the best lesson I've learned.
Great answer. What is the best vacation that you have ever taken?
Oh, wow. So that's also a tricky one. We've been fortunate enough to travel a lot before kids. So probably pre-kids, our honeymoon, which is in Curacao.
Oh, wow. That's nice.
Right. One of the, near Aruba. A lot of people around this community have gone to Aruba. But I think since kids, honestly, the best vacation is going back home, right? It's kind of one of those things you don't appreciate what you've got until you don't have it anymore.
Yeah.
And what I love about going back home is there's nothing to do and there's everything to do, right? It's out in the country and honestly, you just get up and relax and enjoy nature. And so that's sort of that's my place these days.
Okay. What's one thing that many people may not know about you that you'd like to share?
I don't know. I think so between college and medical school, I took a year off and worked in central Wisconsin for a physical therapist, and he was a big mountain biker, and so I started mountain biking. And I had about a month where I almost canceled going to medical school and moved to Colorado to be a professional mountain biker.
Oh, wow. Wow, I did not know that.
I started racing, and it was like amazing and like super cool, and I was pretty good at it, and so I had a guy who was like, you should come out to Boulder and race mountain bikes.
Wow, the point in your career where professional mountain biker or doctor?
I'm thinking it was probably the right decision to not move to Colorado.
And safer too, probably on your body. before we get into your business, tell me a little bit about your family and your background. I know we learned a little bit about that, but tell us, where you currently live, kids.
So I grew up in Wisconsin, like I said, super small town of less than 500 people, right on the lake. And then I was in Madison for college, and ultimately ended up in Milwaukee, where I did most of my medical training, and that's where I met my husband, Eric, who was born and raised in Saugatuck.
Yeah.
So, I think we hit it off probably because there was just a lot of commonalities about the way we grew up and what we valued. But after we got married and had our first daughter, we just realized, Milwaukee was great. We loved the city, but we really missed the small town feel of the communities that we had grown up in, thinking about how we wanted to raise our children, what was important to us.
Yeah.
We ultimately decided to move back in 2012. At that time, our oldest daughter was 2.5. Anna, our youngest, was born 10 months after we moved.
Yeah.
And so, now we live in Saugatuck. My girls go to Douglas Elementary. My husband laughs because he jokes that the lockers are the same lockers he had,
They could be,
45 years ago. But it's, it's an amazing community, and we really couldn't be happier.
I agree. We're pretty lucky here along the lakeshore. So what was your big push to becoming a doctor? How old were you when you were like, this is the path I want to pursue?
Yeah. So, I think unlike a lot of people, I didn't really realize it until I was in college. I always excelled and enjoyed science, and I always have been a people person and enjoyed that social interaction. So I knew I was going to be in the healthcare field, but when I started college, I actually thought I was going to be a physical therapist. I actually became an athletic trainer and worked as an athletic trainer through college and then immediately after. But it was sort of that experience where I realized, to really have the impact and to, I think, challenge myself in the way that I wanted to. Going into medicine made the most sense. And so I shifted gears about halfway through college and started to take some pre-med classes, and ultimately, like I said, I took a year off because I made that decision a little bit later than most people. But that was, things happen for a reason, and that actually was a really great experience to take time off and work in the real world and see what it's like to not be a student, not have your parents, right, supporting you. And then when I started medical school, I really knew that was what I wanted to do. No
Great.
Question about it.
And then, so you graduate medical school. There's all kinds of different medicine to practice.
Yeah.
What brought you to women's health to specialize in that area?
Yeah. So that too was not a very linear path. I initially, as I mentioned, having been an athletic trainer, enjoying athletics myself, thought that I was going to go into orthopedics. And so I sought out a mentor, a female orthopedic surgeon. It was incredibly interesting and exciting, but kind of decided not necessarily in line with what I wanted my life to look like as a whole. And so then made an odd change and thought I would do cardiovascular surgery.
Yeah.
Also realized that was probably not in line with my other values as far as, again, work-life balance and some of those things. And then I did a family medicine rotation, and I really enjoyed the variety in my day, the ability to work with people of all ages, to connect with people on a level that really was not just one single body part, but kind of recognizing the importance of their whole life, their biopsychosocial health, if you will. And through that experience, really felt like I had a connection with my female patients and experienced patients sharing things that they had never shared with another provider before. And then began to realize there were pretty big health disparities, that women were not necessarily receiving the same standard of care as their male counterparts. And so it felt like a space where, again, I could challenge myself. It was really interesting, and I felt like there was a need that I could fill.
Awesome.
Yeah.
And you're bringing something new to the Lakeshore called Concierge Medicine, I guess you would call it.
Yep.
How did you hear about it? What got you involved with it? And, what ultimately was your main decision on doing it?
Yeah. So I had been an employed physician for my entire career. Started in Milwaukee and then moved over here and worked for Holland Hospital. I had heard about concierge or membership medicine probably 10 to 12 years ago, even before we moved to West Michigan. And it was intriguing to me at the time, but with a young family, the idea of starting my own business felt a little bit overwhelming, and I had a really wonderful opportunity to join Holland Hospital. But over the course of the years, just started to feel more of the constraints that are put in place by insurance companies and larger organizations. Felt like I was losing autonomy and my ability to make decisions that felt right for my patient. Was being torn in directions that the decisions had to take into account, again, other entities that really didn't belong at that decision-making table. And so I think I got to a space where I felt like the only way I could deliver the type of care that my patients deserved was to step away from that traditional model and take a chance doing something very different and innovative.
And what does that look like? Tell me, like, for those that may not know what concierge medicine, what does that look like?
Yeah, so concierge, direct primary care, two terms really kind of describing a very similar model, really is we remove insurance companies from being a barrier between the type of care I deliver to a patient. So patients pay a membership fee to be in the practice. And from the standpoint of concierge, it's a slightly higher fee, but it really covers all care provided by me. We guarantee same day or next day appointments. We spend the amount of time that patients need and want. So my average visits are about 60 minutes. Although if it needs 90, then we schedule it for 90. Again, I'm not listening or needing to follow the rules of an insurance company that says, well, this is what you get. You get 20 minutes, you get 10 minutes. And so again, so patients pay that one fee. They get a standard of care that's really far above most traditional spaces.
And they get pretty good access to you, right? You give them, you give them your cell phone number?
Yeah, so for my concierge patients, they have direct access to me. So, during the course of a normal business day, it works pretty much like a traditional office. Patients call, but they know that they're going to be seen when they need and want to be seen. The big difference is after hours. So, lately the best example has really been COVID. So I've had a lot of patients who over the course of the weekend either become aware of a potential exposure or begin to have symptoms, and they call me on my cell phone. I'll give you an example. A couple of weeks ago, I had gone to exercise class. I was at the farmer's market. A patient called me while I was at the farmer's market. I said, can you meet me in 30 minutes? I'll see you at my office. So I drove over here, exercise clothes and all, met the patient. But for her, that meant she had answers right away, and as she sort of described, this saved me so much money because I don't have to shut down my business. And
time, too, I'm sure.
Waiting to know if this was an exposure. So really it is, you're always going to get me, which means continuity, right? And my practice will be limited to 300 patients. So I really know my patients. It really is a relationship unlike anything most people have experienced with a typical healthcare system.
Okay. And it looks like you're partnered up with Ms.Medicine.
Yes.
What does that do for you in your practice?
Yeah, excellent. So honestly, it allows me to have a reach that goes outside of the walls of my clinic because Ms.Medicine's mission and vision really is to elevate the standard of care for women across the globe, across the U.S. I'm partnered with other Ms.Medicine providers such that we can really rely upon each other as colleagues to discuss cases. So it, one brain is great, but multiple brains are even better. Right now, they're in the process of developing a clinic in Naples, Florida. I have several patients who winter in Florida. So now there's also this ability to provide some continuity even when patients are outside of my four walls of my clinic.
Larger reach, I love it. Yeah.
And they just have, again, I really truly believe in their vision and their statements. They're all about evidence-based medicine, right? Which is just making sure that the therapies we're offering to our patients, number one, and first and foremost, are safe. But number two, they're effective, right? Because if you're going to spend money on anything, you want to know that it's money well spent.
Okay. Now, what are some other services, products, besides the medicine and the practice that you offer here?
Yeah. So I have a nurse practitioner in the office, Anna Spoolhoff. Her practice is referred to as direct primary care.
Okay.
It's a very similar concept, but at a far lower price point, and without some of the added extras. So patients don't necessarily have her cell phone for after hours, but they do have the benefit of knowing that she will only have about 400 patients in her practice. They will be seen the same day or next day, and again, they'll get the amount of time that they need and deserve, not the typical 7 minutes that you would find in most offices. So we have Anna's practice. We have a nurse, Kelly Rivera, who is trained and skilled in the area of aesthetics.
Okay.
So she offers those services through our office. And then I've partnered with an amazing physical therapist, Erin Lamb. And so Erin's business, Equilibrium Physical Therapy, is actually housed in our space as well. And so, and that's just the start. We're working on...
So you said aesthetics. Like, tell me what that means.
Yes, I'm sorry. So,
I think I know, but I'm just wanted to make sure.
So Nurse Kelly does injections, so Botox primarily, and some fillers. And then just does a lot of skincare consultations, emphasizing the importance of sun protection, products that women can use to help maintain moisture.
And one brand that you do carry is...
Yeah, we carry Revision Skincare, which I have to say, like, I wasn't necessarily raised in a space to pay attention to those things, and so I've been a late comer to that space, but yeah, it's been an amazing product, and it seems really popular in West Michigan, so we've been happy to have that.
Nice. What has brought you the most joy since you've opened up your own practice?
Oh, goodness. Yeah, I've said numerous times to people I've never worked as hard in my life as I am right now, but I've also never felt so much joy and satisfaction in my work, right? So I think, number one, to be able to create a space for my employees, for patients to come and really feel truly welcomed here, that they matter and they care, has been really nice, because again, as an employed physician, you can create that to a certain degree, but a lot of it is out of your control. So to have the ability, that autonomy has been amazing. And to just be there for patients in a way that I was sort of always driven to do, but not necessarily able to in the confines of a traditional practice, has been amazing. I mean, there's nothing like forming those relationships. I think it's probably why most people go into medicine.
What do you hope to see for medicine in the next 5 to 10 years, or where do you expect medicine may be going?
Yeah. Oh gosh, that's such a big question, because I think the answer we may have provided pre-COVID to post-COVID looks so very different. But I really think we're at a tipping point. What we see is people are paying more and more money in premiums and deductibles, but not necessarily for better care. And so I think, the fact that we've almost got 100 patients in not even 2.5 months tells you that people are frustrated and they're looking for something different. And, like we started with, like, change is inevitable and oftentimes important for us to move forward and find a better space. So I think my practice and other practices like this are going to really push healthcare in a direction that hopefully comes back to where it should always be, which is between a patient and their provider, without the overreach of some of those other individuals.
Yeah, no, I think you're right when you said COVID's kind of changed things in the direction of the things, so it'd be interesting to see the direction that goes. Yeah. Definitely,
we've already seen changes in technology. I mean, part of concierge and direct primary care or membership medicine has always included virtual visits, right? This ability to say, you know what, first and foremost, I'm going to practice good medicine, but the next piece is what's convenient to you, the patient, right? So we've always done virtual visits because there's no need to make a person come in if it's not medically necessary. COVID has forced everybody to try to figure out how to do that, to keep people safe. So I think whereas healthcare may have been a little bit behind with regards to technology, we're now sort of realizing the importance, or some of the larger systems, of really kind of being at the cutting edge of technology, which probably holds true for any number of businesses when you start thinking about, the point of care activity of changing money, etc. So
yeah, no, you're right. So how can people get a hold of you? What's the best way to contact you? and find out more information about you?
Yeah, so we do have a website. It's lauriebirkholzmd.com. All of the practice information is listed there, details about the difference in the two practices, pricing. We've got a great frequently asked questions page because it is a new model and people have questions. We also offer a free 30-minute meet and greet, an opportunity to come meet me and or Anna and learn more about the practice. And so patients can, again, either go to the website or give our office a call at 616-345-5263. And again, if there's any questions, we're more than happy to welcome people in. You know, I used to joke that people spend more time trying to choose their kitchen appliances than they do their healthcare providers. So, I mean, it's important that you feel connected and comfortable with your healthcare provider. And so we just want to give people the opportunity, come see the space, meet us, ask about us, and, you know, learn more about the model.
Well, thank you very much, Laurie.
Thank you.
Pleasure talking with you.
Yeah.
Be sure to check out Dr. Laurie Birkholz, and have a great day. We'll see you.
Awesome. Thanks, Travis.
Thank you. Bye.
Are you famous? I'm